Okay, so picture this. You look down and see a patch of your skin that's suddenly red, hot, swollen, and man, does it hurt. It's a pretty common and, kind of scary experience. You just want it gone. But what's the smartest way to actually make that happen?
So let's get right into that. Because the modern way of thinking about this very common problem is all about being precise. It's about doing exactly what needs to be done and nothing more. This is the new playbook.
The condition we're talking about is cellulitis. And really, all it is a bacterial infection, but it's in the deeper layers of your skin. It can pop up on anyone, pretty much anywhere on the body. And even though it's super common, how we treat it has gotten a whole lot smarter.
In the past, the go-to reaction might have been to just throw the kitchen sink at it, right? Run every test. Start the strongest IV antibiotics right away. But today, we're going to walk through the modern playbook, which is all about how doctors make these more targeted, more intelligent decisions for this really common problem.
So the first big decision point for a doctor is testing. And the whole mindset here has shifted from more is better to smarter is better. That means being really selective about when you order blood work or any kind of imaging.
Let's start with something like a blood culture. If you come in with a classic case of cellulitis, but otherwise you feel okay, you're what we'd call systemically well. That blood culture is almost never going to be useful. Seriously, the results hardly ever change the treatment plan. But, and this is a big but, if you're systemically unwell or your immune system is compromised, well, that's a different story. Then that blood culture becomes a really important piece of the puzzle.
So, what does systemically unwell actually look like? Well, it means the doctor is seeing some serious red flags. Things like a fever, those red streaks spreading from the infection, a heart rate that's staying way too fast, or low blood pressure. Any of these are signs that the infection might be more serious, and that's when you gotta dig a little deeper.
And you know what? The exact same logic applies to imaging, like X-rays or ultrasounds. For a straightforward case, you just don't need it. But if the doctor thinks there might be something else going on under the skin, like a hidden pocket of pus, what we call an abscess, or maybe a splinter you forgot about, or a much deeper infection, that's when imaging becomes absolutely critical. A quick ultrasound right at the bedside can be a game changer here, helping to see if it's just cellulitis or an abscess that actually needs to be drained.
Now this is so important. This highlights the absolute urgency in some rare situations. We're talking about necrotizing fasciitis. You've probably heard it called a flesh-eating infection. In those terrifying cases, every single second counts. If a doctor even suspects it, they're not going to wait around for an imaging report. They are getting a surgeon on the phone immediately. Time is everything.
Okay, so let's move on to the next major decision. Treatment. This is a big one. When does someone need to be hooked up to an IV for antibiotics versus just taking pills at home? It's a really key fork in the road for their care.
The evidence really points to 3 clear situations that trigger the need for IV antibiotics. First up, if the patient is systemically unwell. If you're seeing those red flags we just talked about, that's an immediate reason for IV treatment. The second trigger is if oral antibiotics just aren't working. You've been on the right pills for 2 or 3 days, but things are actually getting worse. And finally, it can be a simple practical issue. If someone literally can't take or absorb the pills because they're vomiting or have other gut issues.
But hey, antibiotics aren't the whole story here. The modern playbook also includes a couple of simple, low-tech, but honestly surprisingly powerful therapies that can help speed up recovery right alongside the medicine.
We're talking about 2 really key strategies here. First, simply elevating the arm or leg that's affected. And second, for the right person, adding a short course of something like ibuprofen, what are called NSAIDs.
And here's the why behind elevation, which is just brilliant in its simplicity. Propping up an arm or leg with cellulitis isn't just about comfort. You're literally using gravity to help drain away all that extra fluid and all the inflammatory cells that rush to the scene. It physically reduces the swelling, and that can help the infection clear up faster. It's so simple, but it really works.
So what about those NSAIDs, like ibuprofen? The data here is pretty fascinating. For certain patients, adding a short course of NSAIDs can make them feel noticeably better by day 3. Now, it might not change the final outcome. They were probably going to get better anyway, but it helps them feel better, faster, because it's directly fighting that painful inflammation.
All right, so let's wrap this all up. This modern approach, this playbook, it's not about doing less care. It's about doing the right care for the right situation. It's a smarter, more efficient, and evidence-based way to handle a super common problem.
So here's the playbook in a nutshell. 1. Save the tests for when you see specific red flags.
2. Only use IV antibiotics for those clear triggers we talked about. 3. Encourage simple limb elevation for faster relief. And 4. Think about a short course of NSAIDs to help with recovery. It's that straightforward.
And that kind of leaves us with the bigger, really interesting question, doesn't it? We've just seen how our approach to a common infection like cellulitis is becoming way more refined and targeted. It really makes you wonder, as our medical evidence keeps getting better and better, what other common, quote-unquote, routine treatments are next in line for their own modern playbook?